The first indication that plastics might have implications for human health was a report in JAMA around 1972 of 4 cases of angiosarcoma of the liver, a very rare cancer, in a small group of chemical workers at a PVC polymerization plant in Louisville, Kentucky. And I was working for CDC at that time, and I got involved in that investigation. And although we didn't really realize that microplastics in the ocean and angiosarcoma of the liver in Kentucky were somehow connected, it's now clear that those are 2 pieces of a puzzle. So fast forward to the near present, after we had brought out that report on human health and ocean pollution, I was approached by the Minderoo Foundation from Australia, and they wanted to join forces with the Scientific Center of Monaco and do a big report on plastics in human health. And that led to our producing a massive document called the Minderoo-Monaco Commission on Plastics in Human Health, 150 pages, 1,500 references that we brought out in 2023. And the main conclusion of that report was that plastics harm human health at every stage of the plastic life cycle. In production, like PVC polymerization workers, during use, when people like us use plastic in our homes, and in disposal, when plastic waste gets into the ocean but also affects people. So the background to the Marfella study is that over the past 5 or 8 years, scientists and physicians have begun with increasing frequency to detect microplastics in the human body, in a number of organs, in the gut, in the lungs, in the brain, in the great vessels, in the placenta, in the testes. And nobody knew whether or not those microplastic particles had any harmful health effects. We know, of course, that microplastic particles contain all of the chemicals that are in plastics. So in a sense, microplastic particles can act as vectors, as Trojan horses that carry things like phthalates and bisphenol A and brominated flame retardants into the human body. But still, there was no information one way or the other as to whether microplastic or nanoplastic particles caused harm. And against that background, Marfella and his colleagues in Italy decided to investigate the potential impact of microplastic particles on cardiovascular disease. And the approach was very clever. They collected plaque tissue that had been removed through carotid endarterectomy from 312 patients. And they took that tissue to the laboratory, and they basically did microscopic examination of the plaque tissue to ascertain whether or not the plaque contained micro and nanoplastics. And what they found was that 58% of the 312 patients had microplastic particles, and the other 40%, approximately 42%, did not have microplastics. Then they followed those patients over the next 3 years, and they were able to follow individual patients over that period of time so that they could link individual measures to individual outcomes. So while it is indeed an observational study, that prospective dimension and the individual linking of records gives it a lot of power. And what they found was that the folks who had micronanoplastic particles in their carotid plaque tissue had a 4.5-fold, which is to say a 450% increase in risk for non-fatal myocardial infarction, stroke, or all-cause mortality over the 3 years following carotid endarterectomy. That's a striking finding. Now, having said that, it's only one study, and it is indeed observational, and it certainly does not prove cause and effect because it's only a single study. On the other hand, it's very seldom that an epidemiologic study finds a relative risk as high as 4.5. Usually when we're talking about the risks of dietary factors, for example, or exercise, we're talking about 40% or 60% or 80% increased risks, not 450%. You only get those kind of big risks with cigarette smoking, with asbestos, with some nasty industrial chemicals. So I think it's a finding that has to be taken seriously, even though it certainly does not yet prove cause and effect. And other investigators need to be undertaking studies urgently to either confirm or refute the findings. It's always possible that some confounding factor having to do with diet or lifestyle or something else accounts for the findings that Marfella and his colleagues saw. But a 450% increase is a big risk, and it can't be wished away. And the second observation that really piqued my interest were the data that were emerging from the marine biology literature, from the environmental science literature, people like Richard Thompson, people like John Stegeman and Mark Hahn at the Woods Hole Oceanographic Institution, who were finding microplastics everywhere they looked, all over the ocean, deep in the ocean floor, in the Himalayan glaciers, in the Arctic and Antarctic ice caps. And I said to myself, here we have a material made of fossil fuels containing thousands of toxic chemicals that's ubiquitous in the Earth's biosphere. We've got to start looking at the human health effects of this stuff. And I wasn't at all sure where the journey would lead when I started. And we put together the group of people who constituted the Minderoo-Monaco Commission on Plastics and Human Health. And we spent quite a bit of time talking about the problem and scoping its extent. And we came to the realization that what we really needed to do was look at plastics across their whole life cycle. We couldn't just look at it piecemeal. It's easy to spend a lot of time studying the health hazards of fracking workers who extract the gas or plastic production workers who are exposed to chemicals. It's very enticing to think about studying children who are exposed to plastic products and get plastic chemicals in their blood. It's interesting to think about what happens to plastic when it gets disposed of in the environment and breaks down and so on and so forth. But we realized that to get a comprehensive picture of the health hazards of plastics, we needed to take a life cycle approach. We needed to begin by looking at the fracking and then use and then disposal. And we needed to marry this life cycle approach to a very intentional focus on health effects. I recognize that most of the literature on plastics up until the last few years has focused on environmental and ecologic effects, which are clearly important, and they set the context. But I said to myself, we need to go further than that. We really need to look at the human health effects. And in some way, that intellectual journey, I think, is parallel. It's a few years behind, but it's parallel to the thinking that's gone on in the climate change community in recent years. For a long time, climate science was about molecules in the upper atmosphere and the Keeling curve and some elegant stuff, but it didn't have much relevance to people in their daily lives. And it's in the past 5 or 8 years that the climate community has come to realize that climate change is not just something for the 23rd century, but rather it's having effects here and now. It's affecting people's health. It's affecting children's health. Witness the wildfires we're seeing right now in California. And we're going through a parallel intellectual development in thinking about plastics and moving rapidly to bring concerns about human health to the center of the discussion. I have absolute confidence that micro and nanoplastic particles are getting into the human body. I have absolute confidence that a number of the chemicals that are in plastics, like phthalates, like bisphenol A, like brominated flame retardants, are damaging human health. There are abundant, high-quality epidemiologic studies, toxicologic studies, mechanistic studies that support those assertions. I think we still need to wait for more data before we can say with a high degree of confidence that microplastic particles per se cause cardiovascular disease or disease in other organs. I want to see some studies that either confirm or refute the Marfella study before I say it's a proven case of causality, but I'm highly suspicious. I think the exposure is mainly via two routes, diet and inhalation. The inhalation of microplastic particles is especially an issue in urban areas and along highways because a major source of airborne microplastic particles is wear and tear on tires, truck and car tires. And when tires go down the highway, they throw microplastic particles into the air and we breathe them. There's really not much you can do about that except decide where you want to live. The other route is diet, and Seafood is certainly one source of microplastic particle ingestion. When plastics get dumped into the ocean, they break down into microplastic and nanoplastic particles. They become incorporated into the marine food chain, move up the food chain, and accumulate in filter feeders like oysters and mussels, clams, and in predator species at the top of the marine food chain like tuna fish or swordfish or striped bass. Some chickens and beef can contain microplastics because there's microplastic particles in their diet. What steps can people take to reduce their exposure? Don't think anybody can eliminate it completely. It's too ubiquitous, but there are things we can do to reduce it. So one is to shop wisely. Buy organic food to the extent you can afford to do, because it will have been exposed to less plastic. Free-range chicken, free-range beef, for example, as opposed to chicken and beef that are raised in feedlots. Eating organic vegetables won't avoid plastics per se, but it will certainly reduce your pesticide intake by 90%. That's been well shown in some good crossover epidemiologic studies. Try to avoid, to the extent possible, food that has been wrapped in plastic. I know it's awfully hard to get away from plastic these days. Let's talk about strategies for reducing plastic in society in a moment. But at least at the personal level, try to avoid food that's wrapped totally in plastic. Get the fruits, the vegetables, the cuts of meat that are laid out in the open on the shelf, and then bring them home in a paper bag or a glass container instead of a plastic wrap. People can also do stuff at the societal level, locally in their communities. People can do things, for example, to get together and persuade their city, their town, even their state, to ban plastic bags. Some African countries, Rwanda and Kenya are notable, have nationwide bans on plastic bags. And I've been there. You no longer see plastic bags alongside the highways in those countries in the last 3 or 4 years, because they've done a marvelous job of banning plastic bags. And that just reduces everybody's exposure to plastics in the society. Hospitals and healthcare systems can reduce their use of plastic and therefore reduce their generation of plastic waste by doing things like getting away from plastic plates and plastic knives, forks, and spoons in the dining halls, cutting down our use of disposable plastic instruments, going back to steel, moving away from disposable plastic sheets that get used once and thrown in the bin, go back to cotton, which gets washed. The healthcare system has the chance to be a role model and a leader in this. I think we physicians, and indeed all healthcare providers, nurses, physicians' assistants, we have a lot of credibility in society, where even in today's polarized world, we are trusted messengers. And that gives us the opportunity to speak out about things like plastic and climate change. And so in terms of the standard list of risk factors that we discuss when we're talking with our patients, we all talk with our patients about not smoking, eating a healthy diet, getting sufficient exercise, getting sufficient sleep, avoiding obesity and all that stuff, all of which is good. We've seen more than a 50% reduction in cardiovascular mortality in this country since the inception of the Framingham Heart Study in 1948, because the science of risk factors has been translated into clinical practice. Now it's time to add a few environmental elements to that standard canon of risk factors and talk with patients about reducing their carbon footprint, reducing their plastic footprint, reducing their exposure to toxic chemicals. So when I talk to families, and I appreciate all the stress that families with young kids are under, I tell people that they do have agency. They do have the power to make change. And I talk about people's ability to make change on 3 levels. So firstly, they can act as the CEOs in their own home. They have power over what they purchase, what they bring into the home, and what they feed their children. And of course, you've got to be realistic here. Nobody's going to get away from plastic entirely in the year 2025. It's not possible. But you talk to people about at least reducing their exposure. Try to tell them not to stress out about it, which is sometimes easier said than done, I recognize. But try to say to folks, listen, do what you can, and your kids will probably grow up okay. At least do what you can within your own home. But you can also band together with your neighbors and your fellow citizens. in your community to push for things like bans on plastic bags, bans on plastic tableware in the school cafeteria, things like that. And then finally, we're all citizens, right? And if we've learned anything, it's that democracy is not a spectator sport, and that people need to become politically educated about environmental hazards such as plastics and climate change. They have to vote, and they have to seek to elect candidates, either Republican or Democrat, it doesn't matter, but people who are willing to listen to the science and take action to protect children's health. One of the things we all have to bear in mind is that the current situation with plastics is not something that just happened. It's not like an asteroid approaching planet Earth. Back in the 1950s, we were producing less than 2 million tons of plastic per year. Today, we're producing north of 450 million tons per year. So plastic production has grown 250-fold in 75 years. Moreover, it's on track to double by 2040 and triple by 2060. And the reason production is growing so rapidly and projected to grow even more rapidly in the next few decades has to do with the fact that the fossil fuel industry, which is the main producer of plastics, is in a quandary right now. They're in a place they've never been before. On the one hand, they've got more gas, more oil, more coal than they ever had before, thanks to fracking. And at the same time, they see their market for fossil fuel, for gasoline, for diesel, declining because people are buying electric cars, people are putting solar panels on their roofs. They're just not burning as much fossil fuel as they used to. And that trend is going to continue into the future. And Exxon and Chevron and the other big petrochemical companies see that. So what they're doing is very deliberately diverting their investment and their fossil carbon feedstock away from gasoline and into plastic. Just in the last couple of years, a consortium of petrochemical companies completed construction of a $6 billion factory outside Pittsburgh to convert fracked gas from Appalachia into plastics. And at the very core of this strategy are single-use plastics. Single-use plastics now account for in the neighborhood of 40% of all the plastics that's made. That wasn't true in the past. In the past, most of the plastics that were made were durable plastic products that could last for years or even decades. But now 40% of the plastic that comes on the market is stuff that's basically one and done. You tear off the wrapping, you throw away the plastic bag, you throw away the plastic shampoo bottle, whatever, it's gone. Except, of course, it's not gone because it goes into the environment. But single-use plastic has been an economic bonanza for the fossil fuel industry because they can keep extracting more gas, they can keep extracting more oil, turning it into plastics that people throw away today and have to repurchase again tomorrow. The core recommendation of our Minderoo-Monaco Commission on plastics and human health addressed this issue. We never advocated for anything like a complete ban on all plastics. As a physician, I recognize full well that I need plastics to practice medicine, intravenous tubing, endoscopes, laryngoscopes, the list goes on and on. We're not going to move into a world without plastics. Plastics are too useful. But what we can do is we can use our intelligence and our political will to distinguish between the plastics that we really need, whether it's for medicine or aerospace or engineering or other applications, distinguish the plastics that we really need from the plastic that is fundamentally stupid. We don't need plastic bags from the dry cleaners. I'm sorry. You don't need plastic bags from the supermarket. Cloth or paper would suffice perfectly well. We don't need every single head of lettuce to be wrapped in a plastic sheet. These are all manufactured uses of plastic, artificial uses of plastic that have been stimulated by some very clever engineers in the petrochemical industry. And I think if we're ever going to get out of the current situation that we're in with plastics, we're going to have a combination of national laws and UN treaty that caps plastic production, enables us to continue to make the plastics that we really need, and do away with the plastics that we don't need at all and that in fact are harming us. All plastic, any plastic whatsoever, has two main components. Firstly, it has a a polymer backbone. It could be polyvinyl chloride, polystyrene, polyethylene, polyurethane, and so on, consisting of multiple repeating elements, small carbon molecules that are joined by carbon-carbon bonds. And so every plastic has that as its backbone. And then manufacturers insert thousands of different chemicals into the polymer to give the polymer particular properties. They can put in dyes to give it color. They can put in heavy metals like lead in some instances to give it stability. They can add phthalates, which are called plasticizers, to give the plastic flexibility. For example, polyvinyl chloride by itself is very rigid. Think of a PVC pipe. But if you put phthalates into polyvinyl chloride, it makes the PVC flexible. Think of a rubber ducky. Other additives include brominated flame retardants, organophosphate flame retardants, and on and on and on. It's been estimated by credible groups in Europe that there are at least 16,000 different additives in plastic, and many of these are toxic chemicals. They include carcinogens like benzene. They include neurotoxicants like brominated flame retardants and phthalates. They include endocrine disruptors like phthalates that can interfere with the development of the reproductive organs in utero during pregnancy if a mom is exposed, or bisphenol A, which acts as an endocrine disruptor and interferes with lipid metabolism in the liver, resulting in elevation of serum lipid levels, increased risk of diabetes, obesity, cardiovascular disease, and stroke. So not all polymers are equally hazardous, and almost certainly the most toxic of the polymers is polyvinyl chloride, because when PVC is burned, it releases dioxins and furans to the atmosphere, and of course dioxins and furans are extraordinarily toxic compounds, very potent carcinogens. And the manufacture of PVC is fraught with hazard. PVC is nasty stuff, and if I had to pick one polymer to ban, it would be PVC. There may be others, but I'd start there. And then when it comes to the additives, there's for all practical purposes, no regulation of the additives that go into plastic. I think the two things that are really needed to control the hazards of plastics are, firstly, the cap on plastic production that I've already discussed, and secondly, some very strong oversight, regulatory oversight of the thousands of chemicals that go into plastic. It just makes no sense at all to be putting carcinogens, developmental neurotoxicants, and known endocrine disruptors into plastic products that small children and pregnant women are using every day. There's no word to describe this except insanity, and it's something that we have to change.